testing. We're testing
When they
Bruising.
don't do bone setting.
Yeah,
Oh.
they don't do the bone setting. They'll do surgery. And to me, that's all negative because the bones. After that, you're never the same. Okay. And not only that, they charge insurances a humongous amount of money. Okay, for all kinds of surgeries. So if you suspect a fracture in a fifth metatarsal, okay, tap the bone here. Just lightly tap along the side, and it'll be very painful. Okay. You'll know that's what it is. If it's non-displaced, you really don't need to do anything other than do your acupuncture, do your herbs topically, give them herbs to take. It will heal very fast. Okay. If it's displaced, most of the time they'll just leave it like that because it's such a small part. It'll heal. Okay. In some cases, it won't heal.
Does it heal if they walk on it, though?
They'll give them those big, huge, ugly boots
Yeah.
to wear. Yeah. So, a patient comes to my office with an ankle sprain. Okay, there's swelling here, bruising. Okay, let's assume that there is no fractures. Okay, so the way I start treating them is I'll go up to the GB34 and I'll start do circular pressing. Before I even treat here, I will do this. Okay, do 10 times.
Mm-hmm.
Yes. Do stomach channel 10 times. You will find that this area right here is going to be very sore to palpation. Okay. When you sprain, all this also gets pulled. Okay. So it's not just pain here. Okay. This will be very sore to touch, but most likely they won't scream when you do that. When you do here, they'll scream. Okay. It's okay. So we go 10 times.
But they're in a position to kick you. Man.
Up, look.
And you notice he's not close enough to be.
Yeah.
But you're going all the way down to the crease of the ankle, but not
Yeah,
down
here.
into the.
Okay, you go to the spleen channel, same thing. Okay, once you've done that 10 times each, okay, then you'll come over here. Circular pressing on the GB40 and spleen 5, okay, spleen 4. I mean not spleen, liver
If it's sprained, you did it hard or lightly?
4. As much as they can take. If this is generally, it's not going to really close.
Because it's going to be all swollen, too. I mean, just...
It's okay. Just do it. It'll be fine. Okay, once you do that for about a minute, now you can just work around the lateral malleole, the circular pressing. Okay, work on the stomach 42. Initially, when they come to you, you don't want to do range of motion. Okay, why? Because you don't want to stretch the ligament more than what it's been stretched. Okay, so no circular movements. Initially, you don't want to do that. Okay, after several treatments, you can. Okay, now once you work this area, okay, with circular pressing, you can start going in here. Now remember, when they sprain, all those tendons are gonna be overlapping each other. That's why a lot of the time you'll get bumps in here. You know, it'll like you touch them and it'll feel like mountains, okay? Because your tendons have left their grooves and they're on top of each other, okay? So I'm gonna break it apart, okay?
And that'll hurt.
Yes, this will hurt more than here, okay? And it's okay, we don't care.
How long does that take?
About a minute. Okay, now after that you do moss slipping. You can go moss slipping all the way down. Okay, this is to rearrange the tendons where it's supposed to go, okay? Sounds like we're filming a movie for YouTube.
We are.
Okay, now once that's done, I like to do my rolling with your thumb. You do rolling all over the joint.
Bonnie's favorite.
Now, once you do the rolling, you wanna set the navicular bone, okay? So you wanna do a little bit of traction, okay? And just little jerk, okay? Little jerk. Sometimes it'll pop, sometimes it won't. It's no big deal, okay? Now, once they're out of the acute stage where they can actually, they need to mobilize, okay? We'll start with a little bit of rotation, okay? Initially, you do this kind of a rotation. Okay, initially, actually, just this right here, okay? You do this and slowly break into rotation.
But that's when the swelling has gotten down.
Yeah, the swelling. And, you know, this is when you actually do rotation. Is primarily done at the last stage. Why? Because there's still going to be internal swelling. On the outside, when you look, it's going to look real. But internally, there's still going to be a little bit of swelling in the joint capsule. So when you do rotation, it's going to pump that out, get rid of it. Okay, so the range of motion should increase instantly after this. Okay, once this is okay, they can take it. You have the patient lay down on their side. Yeah. And you do larger range of motion, okay? Now, when you do this, you press on GB40, okay? Okay. Now, let's say that they're fine, and they came to your office, and they complain of the sharp pain here, you know,